As always, it's a pleasure to be here in New Zealand, and I always enjoy speaking with colleagues here at the University of Otago. So as Philip said, my topic today is Planetary Health, protecting and promoting human health in the Anthropocene Epoch. That's the end of the talk. Now, I think I need my slides. Let me just put them up for you. So in the talk, I'd like to do 5 things. Firstly, just tell you a bit about UN University and the institute that I direct. To reflect a bit on urbanisation and health, clearly very relevant to what we were discussing here yesterday, and particularly to illustrate in that context the value of eco-social understandings of health. Then a bit about human ecology and systems thinking as methods in global health, specifically about the Commission, which will be at the core of the talk, and then finishing with some implications of all of this for the new 2030 Agenda for Sustainable Development that the Government of New Zealand just signed off in September, along with all the other governments of the nations of the world. So UN University, it was established in the 1970s, an idea of U Thant, who was the diplomat from Burma, the 3rd Secretary General. He was in post in the 1960s. And he was concerned that decision-making about global issues by UN agencies and member states was so highly politicised that it was completely dysfunctional. Perhaps it still is today, but he felt that if there was a university for the United Nations inside the UN, building knowledge and capacity, that it might contribute to that decision-making. And the university got underway in 1973. The headquarters is in Tokyo, funded by the government of Japan, and the thematic institutes are around the world, and they're in countries where the country is prepared to endow funding and not control the work of the institute. In practice, that means there's very few in Anglo-Saxon countries, and mainly in non-English speaking countries, and as I said, the health institutes in Malaysia, where the government of Malaysia has generously endowed $50 million to support our work, which is a very significant contribution from a middle-income country. So here's his picture of the building that is provided for us, and our institute was only established 8 years ago. So the first director was a Malaysian academic. He focused the work on health services and health economics, and when I was appointed 2 years ago, it was to change the focus to health and sustainable development. So when we're thinking about health and future health, there's no doubt that health in this phase, the health of people, continues to improve. So here from the Lancet, the Global Burden of Disease Study in 2013, years of life lost between 1990 2013, and clearly health is improving globally on average across all disease groups. But we face new challenges. Here, the challenge of NCDs. You'd be aware that there was a high-level meeting of the UN system on NCDs in 2011, only the second time that there's been a high-level meeting of the UN on a health issue, the first one, of course, being on HIV/AIDS. So we face health challenges despite the fact that health at this stage continues to improve. And then we need to think of population. Here, population of the world, the purple bars from 1950, projected through to 2030, UN estimates of total population. I find it quite useful to think about these data in the context of my own life. Born in 1960, as Philippa said, my parents on a farm in the Catlins district of New Zealand, when the population of the world was 3 billion. And as you can see there in 1960, 2/3 of the people around the world were living in the countryside, as my family was. We have here in 2015, we're just past the point where now more people live in cities than live in the countryside internationally. And for the foreseeable future, most population growth will be in urban areas, and indeed we'll add 2 to 3 billion more people to the populations of the cities of the world in the next 2 or 3 decades. And when you do the sums, that's more than 1 million people a week that we need to house in our cities. And that's why programs like the New Zealand Centre for Sustainable Cities, the Resilient Cities Initiative here, are enormously important when we're thinking about future health. But of course, historically, we're not the first to be thinking about health in cities. Hippocrates, the father of medicine, perhaps, the Hippocratic Oath, one of his theses was on airs, waters and places in 400 BC. And of course, Rome, the first city of more than 1 million people, there were a number of public health interventions at the time, public baths, aqueducts to bring clean water into the city, the draining of marshlands to prevent vector-borne disease. About 10 years ago, we convened in Australia, when I was working, as Philippa said, with Tony McMichael at ANU, a conference on this broad theme of urbanism, environment and health. This was an Australian Academy of Science under the endowment of Frank Fenner, the very eminent Australian microbiologist. You can see Tony McMichael there at the front, standing next to Jane Dixon and Frank Fenner, who was, at that stage, he was well into his 80s. And the point of this conference, it was a policy conference hosted by the Academy of Science to investigate the relationships between urbanism, by that we meant the ways we live in cities, the consequences of those ways of living for the health of environment and ecosystems, and the consequences for health. Not dissimilar to in fact, the work of the Resilient Cities Initiative here. So this was an effort to bring together scientists across sectors with people from industry, government and policy. And this was one of the slides that Tony McMichael showed at the opening of that conference, a historical view of urban health penalties from the developed country perspective, like Australia and New Zealand, over the time frame from the 1800s through industrialisation, modernisation last century, globalisation and looking ahead, and indicative health risks and impacts, the rise and fall of major challenges as we've grappled with them as public health practitioners and advocates, and infectious diseases largely brought under control, urban air pollution certainly in many parts of the world under control, road trauma, but big challenges that we now face, obesity epidemic, indeed mental health challenges, and absolutely the challenges of longevity in many places, including Alzheimer's disease, and on the environmental side, rising greenhouse gas emissions and climate change. So this is the challenge that we face in striving for sustainable cities, sustainable places to live. And this was another slide, indeed, from Tony McMichael, and those of you that knew Tony would recognise these sorts of slides. That it can be quite complicated, but they are very helpful in displaying the range of factors at play. So here, when we think about urban transport systems and health, and we think about the transport system in a city like Wellington, partly inherited, evolved and planned, and importantly, as we discussed yesterday, thinking about the history of how we got here, critical in thinking about what we might do. And remembering that the transport system reflects our urban planning values, preferences and theories in our context. And on the right here of this slide, in red, a diverse array of potential health impacts of any transport system, and the extent of those mediated by the way we shape things up in our transport system, the modes we offer, the infrastructure we provide, the energy we use, the nature of that energy. Is it fossil fuel energy, or is it this energy around my waistline that we're using to propel ourselves around the city? And then via things like air pollution, greenhouse gas emissions over longer timescales, of course, but noise, safety, and then the feedbacks in terms of the transport system, what that means for the shape of the city, and thereby the walkability of the city, the cyclability, the way we will live. There's further feedbacks. Now, with complicated slides like that, it's then important to think, well, how do we use that in our decision making? And here, one of the things that came from that conference was this framework for sustainability and population health, and we were applying it at the urban scale. And so just quickly, what we did here was, on the top axis, we've segmented what constitutes a city into 6 broad domains: economy and work, transport and urban form, housing and buildings, nature and landscape, media and communication, cultural and spiritual dimensions. Now clearly, when a city like Wellington is operating, it doesn't operate in 6 silos, although if you engage with decision makers, you might think that it does, but that's another story about how we've ended up with those silos of decision making. So it operates as a system, and it has a footprint on our planetary systems. So that's what the top of this framework is about. And on the vertical axis here on the right are what we in public health call determinants of health. The physical determinants of health, the social determinants of health, the economic determinants of health. So the air we're breathing, the water we're drinking, the noise exposures, infection, allergens, chemical exposures, local climatic conditions, food security, physical activity, safety, family relationships, social capital. We could go on. And so in aggregate, these determinants are the things that will help to shape our future health and well-being from physical and mental perspectives. So the point of this grid is that in the cells, where we haven't written words at this stage because it would end up enormously complex, in those cells we can ask research questions, we can ask planning questions, policy questions, and we can grapple with the trade-offs as we make decisions on a daily basis in a city. And we find this quite useful, this sort of schema, in thinking through health impact assessments. We were certainly using it in Western Sydney for the large-scale developments that were being rolled out there. And as you would understand, this provides a very explicit way of encouraging collaboration between urbanists, urban planners, designers, developers, landscape architects, the myriad people who are involved in shaping cities, and the diverse array of human health folk who are also interested in the health outcomes as a result of that. So these things can be quite useful tools for that engagement. And then when it comes back, if you draw the lens back further and think about the work of human ecologists like Stephen Boyden, he's advanced this idea of a biosensitivity triangle. I think a simple yet elegant and profound representation of the challenges we face. So all human activities here on the left have the potential to influence health of people in positive or negative ways, and health of planetary systems in positive or negative ways, and there'll be flow-on impacts from changes in the health of planetary systems to the health of people. And you can make these double-ended arrows because of the feedbacks that are in the system. And I think this is a very useful reminder for us that in everything we do, we need to be thinking about this range of pathways to human health. And indeed, Boyden reminds us that all of us share a set of universal health needs. So we tend to focus principally often on the biophysical needs, and I've been doing so largely thus far in this talk on the left, but we must remind ourselves of our psychosocial needs as well. an emotional support network, the sense of conviviality in the city, opportunities for cooperation. The list goes on. And so this is a challenge for us to integrate that thinking into the work we do. And here, again, is where I think that systems thinking can be a very useful tool. And for 5 reasons. Because it enables us to grapple with the dynamic interactions across sectors that we face. It enables us to think deeply about the feedback in the system and the policy resistance challenge that we're grappling with. Why are we stuck? Why, no matter seemingly what we try and do about the obesity epidemic, for example, do people keep getting fatter? Leverage points, where are the opportunities for change, and then what might be unintended consequences? Because the one thing that we must always be careful, if we come back to Hippocrates, is to do no harm in our public health interventions as best we can. So let's take some specific examples of these system problems, and if we think about unintended consequences. So 200 years ago, health problems in industrialising cities in England led to the Garden Cities movement, which was advanced by planners, was supported by public health advocates as a way of improving health. And indeed, I think we could say that for a time, it probably did make quite a significant difference. But now, in the 21st century, as we aim to house perhaps 9 or 10 billion people by the middle of this century, we're facing new problems, new health problems, from this sprawling pattern of urban development that comes from this idea of garden cities, propelled along by the affordable motor car, and now the relationships to the obesity epidemic, the depression epidemic, asthma are being better understood. So that is an unintended consequence of essentially a public health intervention. And feedback, if we think about climate change is increasing the intensity of heat waves, which is leading to increasing demand for air conditioning, thereby increasing energy use and greenhouse gas emissions from climate control in homes and workplaces. So a fairly classic example of feedback. And at UNU, in our institute in Kuala Lumpur, we're taking an approach to systems thinking that we call collaborative conceptual modelling. It was advanced by Barry Newell and Katrina Proust from Australian National University. Barry's a physicist by original training, and Katrina is an archaeologist, and they make an amazing team. And so they propose 6 broad steps in CCM. So first, what is the challenge? Understanding the problem you're grappling with. Secondly, what is the story? And here's where the history element becomes very important. How do we end up here? Can I see how you think? So that's actually articulating an influence diagram, for example, with the perspective from a public health person, the perspective on the same challenge from a planner, from somebody else that you're collaborating with. Because we're looking at the same problem, but we're looking through different eyes. And so that's a very important step, step 3. And then 4, 5, and 6 is where we start to look at the dynamics. What's driving system behaviour? Where are the leverage points? What might we do for change? And then, of course, the reflective step 6. Can we see with new eyes on this problem? And then we come back to think the next steps. So this is very helpful. I think you'll see from how I've explained that it's very much about people working together across sectors. It's not just all about mathematical modelling. That's part of this, but importantly, it's about collaboration. And so if we then come back to where we started with Tony McMichael's slide about transport, how might we represent this if we were thinking through the systems lens? So the relationships between urban transport, land use, and health and well-being. In the middle of this diagram, we've got the travel that we're doing here today. I did part of the journey over from my hotel, walking, part of the journey in the motor car. So the travel we're all doing here in Wellington leads to a level of emissions which is moderated by the mix of fuels that are used. Again, reminding ourselves that this here, this spare tyre, is a source of energy for moving around the city as much as the fossil fuels in the car. So there's a level of emissions that come from that travel and the way we do it. There is a risk of injury. It impacts our physical activity. How much of that is active travel? How much of it is sedentary? And then when we're thinking again about emissions, through different time scales, we've got the carbon dioxide emissions and the flow-on effects on health. So this is elements of those relationships. It's not holistic, but it gives you a sense of some of those relationships. And when we're thinking about the sort of interventions that we might make, then we need to be over here on the left-hand side, thinking about transport policy and land use policy and the way they interact, the infrastructure that we need in cities, the distances that people need to travel. Where are things located in the city? So it's not just about the motorway or the rail-based transport. It's also about where you put things. Helps to determine the transport task. And then underpinning this, as I said, our attitudes, values and preferences for the way we live in city, and the promotions, incentives and subsidies that we put in place. The things we can do in terms of subsidies on certain types of vehicles, for example. And sometimes these are quite perverse in terms of the outcomes that we get. So this is a way of representing this in a systems diagram. And taking this further, we're now working with the International Council for Science on a new global collaborative program, Health and Wellbeing in the Changing Urban Environment, using systems approaches. And there's a web link there to the platform, and the IPO is in Xiamen in China. And both Philippa and Rafe have been involved in helping to launch this program over the last couple of years. So now, for this next bit of my talk, I'd like to just whip through some slides from the Lancet Commission on Planetary Health, funded by the Rockefeller Foundation. This was an idea of Richard Horton, the editor of the Lancet. He proposed this commission to the Rockefeller Foundation at their event in China 2 years ago, and at which they were looking ahead, following 100 years of work of the Rockefeller Foundation on public health globally, and they were thinking, what should they be focusing on for the 21st century? Richard proposed the need for a new discipline that he is calling planetary health. A discipline that focuses on the health of civilizations. So not necessarily just Public Health 2.0, which is what the Rockefeller Foundation calls it if you go on the website, but a truly transdisciplinary view on human health and well-being that importantly brings the health of future generations more sharply into the discourse of population health. And here's a picture of the cover of the booklet. It was published in July, but it appeared in the journal just a couple of weeks ago, actually. And there's a link there to the website, and there's a range of papers. A number of New Zealanders were involved in kicking this off. Robert Beaglehole, Ruth Bonita, and colleagues, and another very eminent New Zealander, of course, Helen Clark, currently the head of UNDP and a former Prime Minister, has been very supportive of this work and the relevance of this work to the UN's 2030 Agenda for Sustainable Development. So she's got a paper on the website of the Lancet about the connections that she sees to the work of UNDP, and she also has a video message on there, but there's a range of different resources on that website. And here's a list of the commissioners. So the report was called Safeguarding Human Health in the Anthropocene Epoch. And the commissioners, I'll just walk you quickly through them because I think it gives you a sense of the range of perspectives that were in play. Chris Bayrer, HIV/AIDS expert from Johns Hopkins. Fred Boltz, a biodiversity specialist from the Rockefeller Foundation. I was involved. Alex Eze, a demographer from Africa. Gong Peng, who's a climate scientist from China. Andy Haynes, who many of you would know, the former dean of the London School of Hygiene and Tropical Medicine. Richard Horton, the editor of the Lancet, as I said. Sam Myers from Harvard, who's a public health guy with particular interests in this area. Sanya Nishta, who's a Pakistani cardiologist trained in the UK, who leads an NGO for cardiovascular prevention in Islamabad. Steve Osofsky from the Health and Environment Linkages project, which is linked to an initiative called One Health, about connecting human and veterinary health. Sabrendo Patniak, who is a ecological economist. Montira Ponsari, who's an environmental scientist from the US EPA. Anya Sukat, a health economist from the World Bank. Jeanette Vega, a health services specialist from Chile. And Derek Yak, public health physician, originally from South Africa, who's worked for WHO. And Sarah Whitney was the very able postdoc from UCL who herded us all and shepherded us through the process and took a lot of the responsibility for the drafting. So we wouldn't have got there without Sarah, that's for sure. And I think the important mention here as well is that this is not really, in one sense, a new idea. For many of you, this is, if you think back to the Brundtland Commission, 30 plus years ago, this was at the essence of what was being strived for. The work of the IPCC and its health connections, the work of the Millennium Ecosystem Assessment, the current work being undertaken by the Convention on Biological Diversity and WHO in this space, and notably the work of Tony McMichael and from his early years, including the book in 1993, Planetary Overload, and if you look at the report, Tony gets a very strong rap for his important contribution. So the Anthropocene, it's a new term, it's a coined term to try and attract people to the fact that the Earth is changing. And so I'd just like to show you a quick video for 3 minutes about the idea of the Anthropocene. What do we mean by this term? Here it is.
This is the story of how one species changed a planet. The latest chapter of our story begins in England 250 years ago. Fueled by coal, then oil, several brilliant inventions appeared. They ignited the Industrial Revolution, which spread like wildfire through Europe, North America, Japan, then elsewhere. The great railways, then cars and highways, connected people across the globe. Medical discoveries saved millions of lives. New artificial fertilizers meant we could feed more people. Population rose rapidly. But this was nothing compared with what was to come. The 1950s marked the beginning of the Great Acceleration. Globalization, marketing, tourism, and huge investments helped fuel enormous growth. People swarmed to cities, which became even more powerful engines of creativity. In a single lifetime, the well-being of millions has improved beyond measure. Health, wealth, security, longevity, never have so many had so much. Yet 1 billion are malnourished. In a single lifetime, we have grown into a phenomenal global force. We move more sediment and rock annually than all natural processes, such as erosion and rivers. We manage 3/4 of all land outside the ice sheets. Greenhouse gas levels this high have not been seen for over 1 million years. Temperatures are increasing. We have made a hole in the ozone layer. We are losing biodiversity. Many of the world's deltas are sinking due to damming, mining, and other causes. Sea level is rising. Ocean acidification is a real threat. We are altering Earth's natural cycles. We have entered the Anthropocene, a new geological epoch dominated by humanity. This relentless pressure on our planet risks unprecedented destabilization. But our creativity, energy, and industry offer hope. We have shaped our past. We are shaping our present. We can shape our future. You and I are part of this story. We are the first generation to realize this new responsibility. As the population grows to 9 billion, we must find a safe operating space for humanity, for the sake of future generations. Welcome to the Anthropocene.
Right, so that video was shown at the opening of the Rio Plus 20 conference organised by the UN in 2012, and it was prepared by the Global Research Programme Future Earth. I think it helps to position the discussion that we need to have about human health in the context of environmental change. So when we got together as commissioners for the first time in July last year, we had a joint meeting organised with the Economist Intelligence Unit, and that group helped to identify a wider group of business people and economic thinkers to engage with the commissioners about trying to keep us focused on what might be economically possible in the context of our current state of development. Now, just to remind us about the challenge that we're facing in the Anthropocene. The first message, these are infographics produced as part of the Commission report. Human population is healthier now than ever before. If we look in aggregate and on average, life expectancy has been increasing, levels of absolute poverty are declining, and child mortality is declining. But to achieve this, we've exploited the planet at an unprecedented rate. So carbon dioxide emissions are escalating, oceans are acidifying, our energy use is propelling ever upward, we're losing tropical forests, our water use is escalating, as is fertilizer use. So this all comes from this idea of a set of planetary boundaries, work done by Johan Rockström and colleagues, and an update by Will Steffen and Rockström and others in Science again earlier this year. So whether we think about climate change, as is happening in Paris this week, as Philip has said, biosphere integrity, land use change, freshwater use, biogeochemical flows, ocean acidification, atmospheric aerosol loading, stratospheric ozone depletion, and novel entities. In some, it's agreed by scientists that we're already exceeding a safe operating space for humanity, and in other areas, we're at risk of doing so if we don't change. And then when we think spatially about the environmental impact of nations, that combination of their ranks for natural forest loss, habitat conversion, marine capture, etc., we need to be thinking about the combination of population numbers and per capita consumption. So in red here, the countries having a high impact on planetary systems, and you can see that the country where I grew up is one of those countries, and it's because of the high per capita consumption in Australia, and also a country like India is one of those countries, and it's because of the high population numbers in India. So what is planetary health? Put simply, planetary health is the health of human civilization and the state of the natural systems on which that depends. So the links to health, on the left here, this is from the Millennium Assessment adapted, the escalation in human pressures on global environment and the health effects on the right, mediated through environmental change and ecosystem impairment, the sorts of things that I've mentioned already: climate change, stratospheric ozone depletion, biodiversity loss, urbanisation. And then the range of effects are the direct ones, which we often tend to focus more on in population health currently, but importantly also ecosystem-mediated effects and indirect, deferred and displaced effects, potentially relating to livelihood loss, population displacement, etc. So it's about, one of the things we emphasise in the Commission report is that we need to think about multiple environmental changes at the same time. Mostly in the way we think this through, we tend to focus on them individually. So when we're thinking of the effects of multiple environmental changes on food availability and quality, we need to think about the relationships to a range of climate-related factors, but also land degradation, soil erosion, water scarcity, loss of pollinators, overfishing, ocean acidification. And when we think about the challenges that we're facing here and now from a public health point of view, in where I live in Kuala Lumpur, air pollution, an enormous challenge across Asia. Estimates from WHO of greater than 3 million deaths each year from ambient particles, particulates, and outdoor pollution, if you like, and also from indoor pollution, perhaps more people, greater than 4 million, so more than 7 million people in total. And then again, looking spatially, thinking about landscape fire smoke, which we're again confronting in Kuala Lumpur in this El Nino year, a very bad year for landscape fires in Indonesia, and so tens of thousands of unnecessary deaths in Southeast Asia and Sub-Saharan Africa from landscape fire smoke associated with land use change, the establishment of oil palm plantations, and Rob is giving me a reminder that time is precious, and increasingly beef plantations and beef farms in Indonesia. So I'll need to start wrapping things up. So other health issues related to planetary health, we think about emerging diseases in this region in recent years, H5N1, SARS in Africa, Ebola, for example, relationships to land use change, forest loss, urbanisation. And then when we think at a national scale about the case of Pakistan, we explored in some detail in the Commission because Sanya was one of our commissioners from Islamabad, and so Pakistan, can see their population numbers in Pakistan over 6 decades. Population has increased fivefold, from 40 million to 200 million. And in a country that faces droughts, floods, and indeed even during the time of our commission, very severe heat waves again. So meeting the challenges, the positive story. I'll skip through this because you're ably led here in New Zealand by colleagues from the New Zealand Centre for Sustainable Cities, one potential intervention approach. So developing sustainable and healthy cities, we give this quite a bit of emphasis in the report. Active travel, public transport, reducing fine particulates, green spaces, biodiversity, reducing the heat island, the mental health benefits of contact with nature, watershed conservation, access to healthy food, including growing food in cities, of course, and increased resilience to floods, storms, and droughts. We're thinking about future food requirements. Then we need to think about multiple approaches. Sustainable intensification, also new approaches, sustainable aquaculture, support for subsistence farmers, and other biofortification potentially. Importantly, from a public health point of view, changes of diets and redirecting land use back to food, reduce food waste. It was remarkable, I mean, many of you may already know this, but 30% of the world's total agricultural land is used to produce food that's never eaten currently. So it's either goes to waste before it's on the table, sometimes in low and middle income countries in particular, or in high-income countries is thrown away from the table. And then we could, of course, reduce our ecological footprint by changing our diets to vegetable-rich diets with meat as the garnish. Future fish requirements, how much of our fish will be wild caught, how much will be aquaculture, and how much of that aquaculture will be sustainable. Forest conservation brings health benefits, whether it's tackling malaria transmission or addressing acute respiratory infections and diarrhea. And as to just make some final points, the circular economy is given quite a lot of space in the report as a way of thinking about our economy, our economic development that is more sustainable and potentially more healthy. And I encourage you to have a look at that section of the report if you're interested in learning more about that. We also strongly acknowledge the need for increasing access to modern family planning. More than 200 million women want to avoid pregnancy and currently don't have access to contraception, and access to family planning could cut maternal deaths by around 30%, and it wouldn't cost that much for the development community. So there's a range of additional infograms and other straightforward messaging about the sort of practical things we can do to advance planetary health. Clearly we can learn more about planetary health like we're doing today, but we can take personal actions, reducing food waste, thinking about our diet, and we can be part of improved governance efforts, indeed, importantly at the city level, which I know is a passion here in New Zealand. So final messages: solutions lie within reach and require a redefinition of prosperity to focus on quality of life and improved health for all, together with respect for the integrity of natural systems. So moving beyond GDP as our measure of human progress. And when we connect this to the 2030 Agenda for Sustainable Development, which, as I mentioned, just signed off at the recent General Assembly meetings in New York in September, what is being advanced is an integrative approach to poverty eradication and sustainable development. All member states now need to sign up to change. So this is different to the MDGs, which were very much focused on development in low and middle income countries, with high income countries providing some financial support. But the SDGs require action across all nations, and for high income countries there may need to be even greater change. And public health advocates argue that contraction and consumption will actually bring benefits to health. So this idea of contraction and convergence in our approach to sustainable development. So here's a listing of the 17 SDGs, and you can see their goal 11, sustainable cities and communities. So in essence, when we think about health in this new agenda, health needs to be conceptualised as an input to sustainable development. That's why we need to keep people healthy, and we need hospitals and health services like this one. But importantly, health is also an outcome of sustainable development, and it's relevant to all of those 17 SDGs, including the urban one. So my final slide is some implications of all of this for education and research in the fields of medicine and public health. So 5 points here. I would argue that we need to embrace eco-social understandings of health, which is the approach advanced by Tony McMichael. And here's a plug for the Festschrift book that we've just completed, available or complimentary online, as well as you can buy the hard copy if you like the hard copy. So that's the first one. This is the approach to public health that Tony encouraged us all to embrace. The second one, systems thinking to complement classical epidemiology in understanding health problems and, importantly, in responding to them. Planetary health is relevant to all medical subspecialties. I met my first environmental cardiologist recently, a guy from Canada who thinks deeply about the environment that people inhabit when he's exchanging with his patients. And two final points. Who has the sovereignty of health? I think as a medical practitioner myself, we have to be careful that we don't define health for all people, that we enable everybody across society to contribute to forming health and shaping health for people. And I think until we do that, it's very hard to get effective cross-sector collaboration. And final point, one thing that we had quite a bit of discussion about yesterday, in fact, at the workshop, was the importance of thinking deeply about the health of future generations and how we bring that, integrate that into the approach we're taking. And I'd encourage you to look at the new Welsh legislation enacted by the Parliament this year in Cardiff, the Wellbeing of Future Generations Act, and perhaps New Zealand could aspire to one of those two. So thanks very much.